Hi, I'm Charlotte Moser, the co-director of the Vaccine Education Center at Children's Hospital of Philadelphia, and this is the VEC Vaccine Notes. Today's topic is measles, mumps, and rubella, and the vaccine that prevents them, called MMR. During our time together, we're going to be talking about these three diseases, the vaccine. We're going to talk about some common questions that we receive here at the Vaccine Education Center related to the diseases in the vaccine. And then we'll finish up with a discussion of the relative risks and benefits of the vaccination and the diseases. A little advance warning, there's a lot to talk about, so I hope you'll hang with me. Let's start with measles. Of the three diseases that we're talking about today, measles is the one you probably hear most about because we have outbreaks of that infection, even though the virus was declared eliminated from the United States in the year 2000. Historically, the outbreaks have been small, but as immunization rates have dropped, we've started seeing more frequent and larger outbreaks. Public health officials and scientists call measles the canary in the coal mine because it is a very contagious virus, probably the most contagious virus we know. And so when immunizations begin to drop, measles is usually the first disease to return. Now, unfortunately, we're starting to see the effects of that erosion of vaccination rates in the United States. Between the years 2000, when we eliminated the virus, and 2024, only 3 people died from measles over that 24-year period. Sadly, in 2025, and I'm taping this in May, we've had 3 deaths this year alone, and 2 of those were in previously healthy little girls. So it is concerning that we're starting to see these increases in cases of measles. So what happens when somebody gets measles? Measles virus spreads through respiratory droplets when somebody coughs or sneezes. But what's interesting about measles and what makes it so contagious is that the measles virus travels in the very smallest respiratory particles. And that means that instead of quickly dropping to the ground, they can hang in the air. They can hang in the air for up to 2 hours. And so what that means is that someone who's infected with measles can cough or sneeze, and those very small droplets will stay in the air. And someone who's susceptible can be exposed to the virus even 2 hours after that infected person has left the area. So think about places like elevators or even waiting rooms. This virus is so contagious that if an infected person is in a room with 10 individuals who are susceptible to measles, 9 or 10 of them will get the virus. And so you can imagine why healthcare providers become particularly concerned when measles is spreading in their area and there's a chance that a measles-infected patient, such as a school-age child, comes into their waiting room with several unvaccinated babies that are too young to have gotten their MMR vaccine, such as infants less than 1 year of age. If you think your child might have measles, when you call to make the appointment, it's really important to mention that to your healthcare provider's office so that they can make arrangements. Some offices have separate entrances. Some might come and check the child in the car before having you come in. They have a variety of ways to try to minimize the chance that the virus would spread from one patient to another in their office setting. Now, for patients who get measles, most of them will be sick for about a week, and they'll have a high fever, a rash, and pink eye. I've heard doctors who've seen patients with measles say that they can tell a patient has measles right away because they're really miserable. The rash that develops with measles will usually start right around the hairline and spread to the face and neck, and then it goes down the body and out to the limbs. So there's a specific order that the rash develops in. And again, that's something that if you notice it happening, you can mention to a healthcare provider because different rashes will spread over the body in different ways. Another thing about measles is that it affects the immune system in 2 important ways. First, during your infection, you have a suppressed immune system, which means your immune system just isn't working as well as it usually does. And secondly, and probably the scarier part of the measles effects on our immune system, is that measles attacks our immune memory cells, which means that after somebody recovers from measles, they're actually still more susceptible to diseases that before their infection, they might have been immune to. Now, our immune systems can recover, but it takes time. It could take several years for their immune system to get back to where it was before measles infection. And so that's a really important but lesser known effect of measles that I think makes wanting to prevent measles an important thing to consider. Finally, some people will develop complications. In some cases, this can be something like an ear infection or maybe pneumonia, which is an infection of the lungs. And in some cases, they develop a condition called thrombocytopenia, which is a case where the platelets, which are the part of our blood that makes it clot, are diminished. And so until those platelet counts recover, the patient may be more susceptible to bleeding. Some patients develop something called hemorrhagic measles, where they get delirious and they have seizures and they have bleeding under their skin. And in some cases, the virus can replicate in the brain and cause encephalitis or swelling of the brain. And in very rare instances, the virus can continue to replicate in the brain without us knowing. In those cases, it appears that the person recovered from their infection, but years later, that virus replicating starts to cause them to lose capabilities that they had. So they may start to lose words, or they may start doing poorly in school. Eventually, they'll start to lose muscle control and have muscle spasms or weaknesses. And ultimately, they'll go into a coma and pass away. This is called subacute sclerosing panencephalitis, and it happens extremely rarely. But we've heard from parents who've had to watch their children succumb to that infection or that complication of measles infection. And it's just heartbreaking, the stories that we've heard. Measles can also cause problems if a person who's pregnant is infected. They can go on to lose their baby. So measles virus has a lot of bad outcomes as potentials. For most people, it's fine. They're sick for about a week and they recover. But we can't know which people will have one of these severe outcomes of measles. Okay, so let's switch gears and talk about mumps, the second M in the MMR vaccine. Now, mumps most commonly causes a swelling of glands known as our parotid glands, and those are below and in front of our ears, right around here. So when children get infected, sometimes they look like they have chipmunk cheeks. Now, mumps can also do some other things. For example, if males are infected and their testicles become infected with the virus, they can become sterile. Likewise, if women who are pregnant become infected, they can miscarry or lose their baby. Although mumps isn't very common anymore, it used to be the most common cause of meningitis in children. Meningitis is inflammation of the lining of the brain and spinal cord. Now, viral meningitis tends to be less severe than bacterial meningitis, so most children recovered. But unfortunately, a significant number of children were left with permanent deafness after they had mumps. Mumps is less common in the United States. Typically, we only have a few hundred cases a year, but we can have larger outbreaks where we have cases in the thousands. Most recently, those larger outbreaks have centered on college campuses, likely due to waning immunity of the vaccine in college-age students. So if you have a student on campus and there's a mumps outbreak, they may be recommended to get a third dose of the MMR vaccine. The last disease we're going to talk about today is rubella. Rubella is most dangerous when it infects pregnant people, and that's because the virus can actually replicate in the cells of the unborn child and cause birth defects. The most alarming effects come when the infection occurs during the first trimester of pregnancy, because the baby can have cataracts or blindness, they can have deafness, they can have heart defects, and they can have mental deficits. In the United States, less than 10 cases of rubella occur every year because of our vaccination rates, and we've had no cases of congenital rubella syndrome, which is the name given when an infant is infected during pregnancy. In other parts of the world, rubella and congenital rubella syndrome still occur. And so it's important that we maintain our immunization rates so that rubella doesn't come back to the United States. So now we're going to talk about the vaccine. And the vaccines for each measles, mumps, and rubella were developed in the 1960s and then combined into the MMR vaccine in 1971. Children are recommended to get 2 doses, one right around their first birthday, and a second dose between 4 and 6 years of age, usually right before they start school. Each of the viruses in the vaccine are called live weakened or live attenuated viruses. So what does that mean? That means that the vaccine viruses are live, and to generate immunity, they reproduce once the vaccine's been administered. They've been weakened because of techniques used in the lab so that they don't cause illness, but they still allow us to become immune to these viruses. So how does that work? There's a technique known as cell culture adaptation. If you think about it, I mentioned that viruses need cells to reproduce. And the ones that they reproduce best in are the ones that they infect us with when they cause an infection in humans. So what scientists do is they take the virus and they grow it in a different kind of cells in the lab. As the virus gets better at growing in that type of cell that they're introduced to in the lab, they're less effective at growing in human cells. So by the time the vaccine virus is made and is given to us as a vaccine, those viruses can only reproduce a few times, enough to generate immunity, but not so many times that they cause illness. So a natural virus, if you will, the virus you might be exposed to in the community, would replicate thousands of times if you were exposed to it. But the vaccine virus only replicates probably fewer than 100 times. So our immune system learns about the virus without actually having to deal with a viral infection that causes us to become ill. There are two aspects of the MMR vaccine that are worth special mention. First, the strain of vaccine virus used for the mumps vaccine is known as the Jeryl Lynn strain. Jeryl Lynn was a 5-year-old little girl who got mumps, and coincidentally, her dad was a scientist at Merck Sharp and Dohme. His name was Maurice Hilleman, and he's probably the most accomplished vaccinologist that the world has ever known. His work is estimated to save 8 million lives every year. Now, at the time that Jeryl Lynn got mumps, it just so happened that her dad was working on developing a mumps vaccine. So when he realized she had mumps, he swabbed her throat and he took the virus to the lab and he grew it. He had been looking for a good strain to make the vaccine virus. And as it turned out, his daughter was quite cooperative. She brought the strain to their house. So he was able to make a mumps vaccine that became available a few years after her infection. The second point worth mentioning is related to the rubella vaccine. And the vaccine virus for that vaccine is grown in human embryo fibroblast cells. This means that the cells used to grow the vaccine virus are human, and they were taken from a terminated pregnancy back in the 1960s. Now, some people wonder how we can still use the same cells from one terminated pregnancy that occurred back in the 1960s. And this is because of a lab technique known as cell passage. Basically, scientists can grow the cells in a way that when cells are reproduced in the lab, each time is known as a passage. And there is a limit of about 50 passages for human cells. But because the cells replicate and scientists in the lab can make large quantities with each passage, they can have an essentially indefinite supply of these cells in order to produce the vaccine for years and years to come. So we do have a bigger explanation for that on our website if you want to check that out. But it is important to know that the rubella vaccine is one of the few vaccines that's made using human fetal cells. Now let's talk about the side effects of MMR vaccine. For most children, it's going to be soreness where the shot was given and maybe a fever. Now, fever from after MMR vaccine is usually timed a little bit differently than what we would expect from most vaccines. And that's because, if you remember, the viruses in the MMR vaccine are live weakened viruses. So to generate immunity, they have to replicate. And that means it takes a little bit longer for the fever to develop. Typically 5 to 12 days after vaccination. If a child's going to get a fever, that's when it would happen after MMR vaccine. There are a couple other side effects that are worth mentioning. First, sometimes the MMR vaccine can cause a high fever, greater than 102 or 103 degrees. If that fever goes up too quickly, the child may experience a febrile seizure. That means a seizure caused by the fever. Those are really scary to watch, but they don't cause a permanent seizure disorder, and they usually don't last too long. And often children who have a febrile seizure after their first dose of a vaccine don't necessarily have that happen again. But if your child has a febrile seizure, you should definitely notify their healthcare provider so they can make a note in their medical record, and you can discuss the relative risks and benefits of future doses of the vaccine. Some children will also develop a rash from the measles component of the vaccine or the rubella component, and those rashes would develop about a week or a week and a half after getting vaccinated for the same reason that the fever is delayed. The good news is that those rashes are not contagious, so the child isn't going to spread the virus to other people if they develop the rash. Another potential side effect of the MMR vaccine is thrombocytopenia. We talked about that before. It's when the cells called platelets in our blood are diminished, so our blood doesn't clot as easily. Now, when thrombocytopenia occurs after vaccination, it's not a permanent condition and it occurs much less frequently. So measles virus and rubella virus can both cause thrombocytopenia. For measles, it's about 1 to every 3,000 to 4,000 cases of measles. In the case of the MMR vaccine, it's about 1 in every 40,000 people. So the chance of developing this blood clotting condition is much less common after vaccination as compared to after infection with either of those two diseases. The last side effect that's worth talking about or mentioning is related to the rubella component of the vaccine. It can cause a short-lived arthritis or swelling of the joints. This side effect is most common when older females, like say 14 years or older, get the MMR vaccine. And again, it's short-lived. There are some data that suggest that it could cause chronic arthritis, but those data are less clear. And so whether someone would develop lifelong arthritis after the rubella vaccine is uncertain. But it can cause this short-lived joint pain or swelling. And so it's worth knowing that that could be something that happens after vaccination. So I hope you're hanging in with me. We are getting there. We're going to switch gears now, and I'm going to just talk about some of the most common questions that we get at the Vaccine Education Center. With the news about measles outbreaks, one of the most common questions we've been getting recently, and again, we're taping this in May of 2025, is whether infants should get vaccinated early or if young children should get their second dose early. So there are 3 things to think about. Let's start with babies and getting an early dose. So the first dose is normally recommended at 12 months of age, but it can be given as early as 6 months of age. So during that period between 6 and 12 months of age, some parents wonder, there are outbreaks occurring, should I get my baby vaccinated? There are a few considerations that are worth mentioning, and we go through this information in more detail on the webpage. So if you're in that category of parents, definitely check it out. But the things to consider are the fact that maternal antibody levels differ among women, and so the amount of antibodies that an infant will have also differ when they're born. Second, when babies are immunized earlier in that period between 6 and 12 months, not as many of them will be protected against measles as if they're as compared to the infants that are immunized at 1 year of age. And third, because their immune system is developing during that period of time, if they're vaccinated early, they probably won't generate as many antibodies against measles. Now, what we know is that even when they get another dose later in life, or later actually in their first year of life, hopefully, their antibody levels will still be somewhat lower than those of a child who is vaccinated at 1 year of age. We think those antibody levels in most cases are still protective, so it's not a big concern, but it is still something that parents who are trying to decide about immunizing early should be aware of. Again, we go through that in more detail on our website. Now, for children getting their second dose early, so normally the second dose is recommended at 4 to 6 years of age. But we've had parents reaching out to us or healthcare providers in different areas of the country wondering if a child who has had their 1 year dose, but they haven't had their 4 to 6 year dose, if they should be vaccinated early. And in that case, it's important to know that that second dose will boost their child's immunity most likely, but that's not the main reason that we give the second dose of MMR vaccine. The main reason for the second dose is that some people don't respond to the first dose, and some people miss getting the first dose. So by having a second dose given at 4 years of age, we're increasing the number of people who are protected against measles. So again, if they get their second dose early, probably they'll have some immunologic boost, but if their first dose worked, they're probably already protected. We just don't know which children will have been protected and which didn't respond to that first dose of MMR vaccine. The second common question that we get is whether the MMR vaccine causes autism. The short answer to this is no. Over 24 studies have been completed by different scientists on different continents, looking at many, many children, and there's been no link found in any of those studies. Now, if you look at the rates of autism, they certainly have gone up, and the Centers for Disease Control and Prevention has been measuring rates of autism since 2000. Every 2 years, they do a survey. So when you look at those rates, we heard back in 2000 that it was about 1 out of every 150 children diagnosed with an autism spectrum disorder. The most recent data, which are from 2022, and were just announced earlier in 2025, was closer to 1 in every 31 children being diagnosed with autism spectrum disorder. That sounds very scary, and definitely it shows that our rates are increasing. But if you step back and look at those rates per 1,000, we see that what those numbers mean is that 7 of every 1,000 children in the year 2000 were being diagnosed with autism spectrum disorder, and 31 of every 1,000 children currently have been being diagnosed with autism spectrum disorder. So yes, the rates have increased, but they are increasing more slowly than what it might seem like based on the rates that we often hear reported of 1 in 31 children. Now, when we compare those rates to the rates of vaccination with MMR vaccine, we see something really interesting. Because between the years 2000 and current day, over 90 of every 100 children have been getting the MMR vaccine. So less than 1 in 100 children in 2000 had autism. In 2022, that number is 3 in 100 children. And 90 of every 100 children are getting the MMR vaccine. So the patterns aren't the same. Over that 20-some year period, 90 of every 100 kids are getting the MMR vaccine, and a small portion of them are also being diagnosed with autism. That tells us two things. One, the patterns aren't similar because MMR rates have been steady over that 22-year period. And two, there are going to be situations where a child gets the MMR vaccine and then is diagnosed with autism, sometimes even close in time. A close in time association does not mean that something is causally associated. So those are important things to remember when hearing about MMR and autism. Another question that we get is whether teens and adults need an MMR vaccine during an outbreak. And this answer is a little more complicated because it depends. So those people who were born before 1957 are generally considered to have immunity to these diseases because they were so common at that time. Most of those people don't need to get vaccinated simply because they were born before 1957. There are a couple of exceptions, such as healthcare workers who are more likely to come in contact with the diseases, or maybe somebody who's doing international travel to an area where there's a measles outbreak. Now, people born between 1958 and 1968 most often may have had the diseases. So if they can show that they've had the diseases, they don't need to get vaccinated. But if they're unsure, they may be recommended to get vaccinated. And even those who were vaccinated in the early 60s, there were measles vaccines used between 1963 and 1967 that were not as effective. So if a person got that vaccine or those vaccines during those years, they often need to get revaccinated. So the best thing to do is, if you're not sure of your measles protection status, is to talk to your healthcare provider so they can help you sort these nuances of the year you were born and whether you have proof of immunity. etc. Sometimes people wonder if a child who's due for MMR vaccine can get that vaccine if a person in the home is pregnant or immune compromised. Because the MMR vaccine is made with live weakened viruses and they're going to replicate, people are concerned whether the virus will transmit to others in the home. And the answer is that those children can get MMR vaccine. It doesn't need to be delayed based on who else is living in the home. These viruses don't transmit to other people, but even if they did, they're weakened viruses, so they wouldn't cause harm. Sometimes people wonder if there's a test to check for immunity against these diseases, and the answer is yes. It's a blood test. But often what you'll find is if you go to your doctor, they're going to recommend getting the vaccine if there's some uncertainty about your immunity. And the reason for that is because the extra dose of vaccine won't hurt you. And if you get the test and you're found not to be immune, you're going to need to still get vaccinated, which means another needle and higher costs. So this is why most often the recommendation is to just get the extra dose of vaccine if there's some uncertainty. Sometimes parents with young infants who are going to be traveling internationally wonder how to handle getting them vaccinated ahead of time. If you're going to be taking your young infant on an international trip, definitely talk with your healthcare provider, your child's healthcare provider. And you may also want to seek out travel medicine experts. Travel medicine experts help because not only do they most often have in stock the vaccines that might be needed for international travel, not only for children, but also for adults, but they also can talk to you about where you're going. They are usually aware of what diseases might be more common to be exposed to in that area. They can find out more about where you're staying and what activities you'll be doing, and then make recommendations to ensure that you have all of the preventions and precautions in place that you need prior to, during, and even after your travel. You can find out more about traveling and vaccines on our website, vaccine.chop.edu, and we also offer links to some travel medicine locator platforms so you can figure out where travel medicine clinics are available near you. Some people wonder if the components of the MMR vaccine are available individually, and the short answer to that is no. You can check our website for more of the reasoning behind that. And some people wonder if a rash develops after getting the MMR vaccine, whether that's contagious. Both measles component and the rubella component can cause a rash, but the good news is that those rashes they're not contagious. So that child with a rash from the vaccine is not going to infect other people who might be susceptible to measles or rubella. Okay, let's finish up with a quick recap of what we talked about and a relative assessment of the risks and benefits when it comes to MMR vaccination. We talked about measles, mumps, and rubella. We talked about the fact that measles causes immune suppression and immune amnesia, meaning that we have this loss of immunologic memory even after recovering from a measles infection. We know that for most people, measles infections are mild and last about a week, but there are some pretty severe complications that can cause long-term outcomes as well. We know measles is one of the most contagious viruses out there, if probably the most contagious virus out there, and that it's really seen as a canary in the coal mine when immunization rates drop because it's the first disease to return because of its contagiousness. We talked about the fact that mumps isn't very common in the United States anymore, but that it can cause deafness, sterility, and loss of pregnancy when it occurs, and that we have been seeing some outbreaks, particularly on college campuses. And we talked about rubella and how devastating that disease can be if a woman is infected during pregnancy. The child can develop congenital rubella syndrome and be born with a variety of birth defects. Again, rubella is uncommon in the United States, but rubella and congenital rubella syndrome still occur in other parts of the world. We also talked about the MMR vaccine, and that for most people, the side effects are minor: soreness at the site of the shot and fever. But that there are some more complex side effects, like high fever that could cause febrile seizures, like drop in the platelet count, known as thrombocytopenia, or joint pain called arthritis. All of these are temporary and people recover from them, albeit the data are a little less clear on whether somebody who develops arthritis after the vaccine could go on to have chronic arthritis. We also talked about the fact that there are no data to support the notion that MMR vaccine causes autism. When our team reviewed the relative risks and benefits, we concluded that vaccination is the safer choice. We hope you think so too. Thanks for listening today.